Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco.
Okay, today we are going to talk about armpit fat and axillary breasts. A lot of people are not aware there's a difference between armpit fat and axillary breasts. Most patients that I do see come in complaining about fatty armpits, complaining that there's a swelling or a bulge around their armpit or even on the lateral chest area. So what are they? Armpit fat is relatively more common compared to axillary breasts. Armpit fat, essentially, like the name implies, thickening or accumulation of fat pads, layers of fats around the armpit or just beside the breast area. So usually patients, especially ladies, are very aware and particular about that, especially when they are wearing sleeveless tubes or even when they are going to the beach. And they find that this is something that they are very conscious and they do not like it. Armpit fats can be caused by multiple factors: genetics, weight changes, aging, and or even hormonal changes. What about axillary breasts? Axillary breasts are different. They are less common than armpit fats. Based on statistics and data, there are roughly about 5 to 7% of female suffer from axillary breasts. Accessory breast is very different from armpit fats. Accessory breast is also medically known as polymastia. It is defined as residual breast tissue that persists from normal embryonic development. So what causes accessory breast to develop? The exact cause of accessory breast is not completely known, but it's believed to be due to embryological abnormality. Sometimes it can run in the family, making some people more susceptible to it. So what are the symptoms of patients suffering from accessory breast tissue? Patients who have accessory breasts usually complain of swelling and tenderness in the affected area, and the most commonly affected area is the armpit, or we call axillary area. It can affect either unilateral, one side, or bilateral. The conditions are usually exacerbated during hormonal fluctuation, during ovulation, pregnancy, breastfeeding, and even weight gain and loss. Patients with accessory breasts suffer from symptoms such as pain, discomfort, frictional irritation, and even discharges, milk discharges especially. So all these cause unnecessary inconvenience, discomfort, and often impede activities of the daily livings. There are some questions I often hear from my patients regarding how to treat and improve their conditions, such as if I work out or slim down my arms and chest, will my condition improve? The answer is it's not so simple. For accessory breast, answer is no, because accessory breast essentially consists of glandular tissue, nipple, loose skin, and such. So it often does not respond to weight gain or weight loss. But however, hormonal changes may affect it. How common is the occurrence of accessory breasts during pregnancy? Based on statistics, up to 5 to 7% of ladies may develop accessory breasts, especially during pregnancy. Are there any treatment options available for pregnant women experiencing accessory breast tissue? The advice that I often give to patients is that there is nothing much that you can do to address those issues when you're pregnant. Are there any treatment options available for pregnant women experiencing accessory breast tissue? My advice for pregnant women suffering from this issue is that there are treatments available after they have completed the pregnancy and breastfeeding. Is it possible for accessory breast tissue to cause complications during breastfeeding? Yes, especially for patients with significantly enlarged accessory breast during pregnancy and breastfeeding period. It may cause pain, swelling, inflammation, discharge, or even infection. For patients suffering from this condition, it can often be very painful and uncomfortable. However, accessory breasts often improve after pregnancy or when they have completed breastfeeding. So, depending on how they feel and how the symptoms are like, if patients are comfortable without too much symptoms after they complete their pregnancy, then they may not want to have their accessory breast removed. Accessory breast is most commonly found in the armpit, on the side of the chest, sometimes extending to the abdomen, or even extending to the back as well. Accessory breasts are most commonly found in the armpit, either unilateral or bilateral. Can accessory breast tissue cause any long-term health complications? Essentially, accessory breasts behave quite similar to normal breast tissue. Can accessory breast tissue cause long-term health complications? Yes, they could, because accessory breast tissue are similar to our normal breast tissue. So they could develop symptoms of disorder which can affect normal breast tissue, such as breast cysts, lumps, malignancy, so on and so forth. So during routine breast examination or mammogram examination should include accessory breast area and the breast tissue as well. Okay, this is how I check for accessory breasts and armpit fats to differentiate the difference between them. So you have to examine properly to see whether there's any kind of glandular tissue and you're trying to examine, and whether or not the symptoms, like for example, any kind of changes in symptoms during their hormonal fluctuations. Accessory breasts, typically they have some changes of symptoms when there's hormone fluctuations like ovulation, pregnancy, breastfeeding, so on and so forth. Armpit fats, they don't. They are usually pretty stable, pretty constant. And weight gain, of course, may make it look worse. Weight loss may improve it slightly, but they won't actually make it disappear. There are some common myths of armpit fats that I often hear from my patients. The armpit fat or bra bulge is caused by tight bra or clothing. No, it's not. Any ill-fitted bra or clothing may make it look worse, but clothing itself is not the cause of it. And armpit fat does not occur only in women. It's just that mostly women are bothered with it and guys are not too concerned about how they look around the area. Although armpit fat is just fats, it is often very difficult for you to target or spot reduce those areas by weight loss or by doing exercise, because it's almost impossible for anyone to spot reduce any part of the body through exercise. Lose weight, you can gain weight, but it's not easy for you to spot reduce any part. That's when surgical procedure or liposuction, or such as fat reduction treatments, come into play. Treatment for accessory breast is with surgery. The reason being because accessory breast consists of skin, connective tissue, breast glands, sometimes nipples. So the only way to improve it or reduce it is to excise it surgically. The surgery will involve using liposuction to shape, contour, and reduce the accessory breast. And finally, surgical excision, removing any excess or remaining breast tissues, nipple, areola, and such, to make it look normal.
Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them. See you again.